When outbreaks of infectious diseases such as Ebola, Mpox, Marburg or COVID-19 occur, the free movement of people, one of the pillars of regional integration, becomes a high-risk challenge. During outbreaks, border closures, quarantine measures, and health checkpoints often restrict movement, undermining trade, livelihoods, and regional integration efforts. These abrupt infectious diseases present a huge challenge to leaders on how to balance a dream of open doors and shared prosperity with urgent need to lock down and save lives.
These outbreaks disrupt what we've already signed on. These outbreaks disrupt the agreements we've had for free movement, a one border crossing point. Now we are putting non-tariff barriers because people are being screened, people are being led to declare where they're coming from, where they're going, how long they're going to stay. People are being inconvenienced in something we'd agreed that would not happen. So the outbreak itself is a natural disaster. It's an act of nature that we did not bring on ourselves, so we need to adjust our agreements.
This tension highlights a critical conflict between regional integration goals and public health survival.
That's the challenge, and that's why we need to have regional collaboration and interventions so that challenges like these ones, we do not handle them alone as individual countries, but we put a regional response so that we are able to wipe out some of these diseases.
Currently, the Intergovernmental Authority on Development, IGAD, is appealing to member countries to fast-track the ratification of the Protocol on Free Movement of Persons in the IGAD region. But how can the Protocol on Free Movement of Persons in the IGAD region help during health emergencies if domesticated by member countries?
It requires member states to be ready, to be equipped, so that each IGAD member state is equipped with the right skills, with the right facilities, the infrastructure, the frameworks, the legal frameworks that govern how they manage the mobility of persons. Of course, there is also an AU protocol on free movement of persons. So this would mean that other member states of AU, including DRC, including Rwanda, that are not members of IGAD, if they can be able to adopt that, if they can be able to domesticate, then it would facilitate easy movement in a sense that they already have structures, facilities, systems in place, and that we are collaborating. This is the role of the REX and the AU to bring about collaboration. But member states need to ensure that whatever is agreed at continental level, at regional level, is applied or adopted at their level. And with that, you can say that the regional continental commitments are being respected and are being followed, and that we are promoting shared prosperity and regional cooperation.
However, this requires political will by the member countries in terms of investment.
So, if the protocol is implemented, it would mean they already have structures, cross-border structures for managing cross-border movements, that they have the personnel, they have facilities, that it will be very easy to govern the mobility of persons. But without the domestication of the protocol, it means that you're just responding to these issues as emergencies, and yet you need to have planned from the development point of the mobility of persons, so that when a health emergency occurs, you're already prepared to deal with it.
The Intergovernmental Authority on Development, IGAD region, home to an estimated 270 million people, is particularly vulnerable to recurring outbreaks of infectious diseases. It is therefore critical that member countries work together in the areas of prevention, but also better management of people during such health emergencies. Adia Nakote, UBC.